I'm Heidi Eccles, and I'm here to talk about illness anxiety disorder in the peripartum period. The aim of this poster presentation is to describe demographics and clinical characteristics of 4 cases of illness anxiety disorder in the peripartum period. So first we need to understand what illness anxiety disorder is. You may have heard it referred to as hypochondriasis in the past. It is classified as a somatic symptom and related disorder in the Diagnostic and Statistical Manual of Mental Disorders 5th edition. The primary symptoms of this disorder is being preoccupied with worry about negative physical health or serious illness. Even after these patients receive negative testing and exams, they're still worried about those physical illnesses. This disorder is a chronic condition and often has onset in early or middle adulthood. It can cause role impairment and it can really disrupt family life. So how many people are affected by illness anxiety disorder? It's estimated that 1.3 to 10% of the general population is affected by this disorder, and it affects men and women equally. Comorbidity is high with many other psychiatric disorders, including depression, anxiety disorder, panic disorder, and obsessive compulsive disorder. This is because they may share causes or symptoms. Because of the many health visits and testing, there's a higher healthcare utilization for people with illness anxiety disorder. People with symptoms of illness anxiety disorder will be encountered more often in primary care settings rather than psychiatric specialist settings. There is no current literature on the effect of childbirth in the postpartum period on illness anxiety disorder, and we do know that childbirth, as well as other things that happen in the postpartum period, can be triggering for women. So it is important to understand the personal and clinical characteristics of women diagnosed with illness anxiety disorder. So I'm going to describe 4 cases that were seen by psychiatrists at the Parkwood Institute. Their ages ranged from 25 to 31 years old, and they all had postpartum onset. One case had symptoms start after the cessation of breastfeeding. The patients with illness anxiety disorder had other current or past DSM-5 diagnosis. This includes MDE, anorexia, OCD, and panic disorder. A family of history of psychiatric illness was seen in 3 of the 4 cases. They all reported remission after treatment. One specific case was preoccupied with worries related to cancer. After seeing multiple specialists and receiving negative testing, she was treated psychologically with cognitive behavioral therapy and medication, leading to remission of symptoms. This case series is one of the first reports of illness anxiety disorder in the peripartum period. Given appropriate diagnosis, all cases were able to go into remission following the appropriate treatment. Healthcare utilization was also decreased once patients were in remission. Due to comorbidity, people with psychiatric disorders who are worried about physical disorders should be evaluated for having illness anxiety disorder, which includes physical exams and testing for physical illnesses. Thank you. If you have any questions, please let me know.